This is Dr. Jun Wang. Dr. Wang is a China-trained traditional Chinese medicine doctor with a PhD in medical anthropology from the University of North Carolina, and she is a U.S. certified acupuncturist. Today, traditional Chinese medicine refers to a broad spectrum of ideas about illness and health. It originates from several heterogeneous and dynamic medical traditions, which developed over the past 3 millennia from magical and religious beginnings. Traditional Chinese medicine is constantly evolving by incorporating new ideas and findings while retaining older beliefs.
Ancient Chinese believed that human beings are a microcosm of the universe. People are derived from and a part of the same primary force which shapes everything in the universe. This force is called qi. Qi is both substance and energy that makes things happen. The movement of qi can be described by the Chinese concepts of yin and yang. Yin-yang are relational concepts which describe the natural cycles such as night and day and the interplay between them. Night and day are complementary as well as opposite. The white part is yang and the black part will be yin. Within yin there's a yang, and within yang there's a yin part. Yin-yang relationship exists throughout the nature and the universe, such as night and day, hot and cold, heaven and earth, man and woman, active and stillness. Accordingly, illness symptoms, herbs, and foods can all be described in the terms of yang and yin. These dynamic and functional interrelations are central principles in Chinese medicine.
According to yin-yang theory, all phenomena are considered to be interconnected and engaged in constant transformation. This theory is applied to both diagnosis and treatment in Chinese medicine. Disease results from breakdown of the balanced and harmonious state between the yin and yang of the body. Chinese medicine doctors focus on the relations inherent in body functions and energy meridians. Because of the interdependent relationship between organs, when disease occurs in one organ, other organs are also affected. When a Chinese medicine doctor sees a patient, they use 4 diagnosis methods: observation, listening, inquiring, and pulse taking to understand the nature of the disease. Diagnostic instruments are not required. The doctor's direct observations of externally recognizable conditions suffice to draw conclusions about internal problems within a theoretical framework. Each symptom or sign has meaning only in relation to all other manifestations. By considering the picture created by all the signs and symptoms, the Chinese medicine doctor identifies the underlying pattern of disharmony. This process is called syndrome pattern differentiation, or identification of patterns.
Symptoms such as cold, deficiency, and chronic belongs to yin syndrome patterns. Symptoms such as hot, excessive, and acute belongs to yang syndrome patterns. When there's too much yang, there will be a hot syndrome pattern with yin deficiency. When there's too much yin, there will be cold syndrome pattern with yang deficiency. Therapy should be designed to address the excess or deficiency. Sometimes the syndrome pattern could be more complicated, involving several organ systems and yin-yang imbalance. In such case, we need to identify the original root of the complexity. As long as we differentiate the yin-yang syndrome pattern in relation to the specific organ system, the root of the disease can be identified and treatment is designed accordingly.
Each Western disease may manifest with many different patterns. Each pattern may give rise to various Western diseases. A pattern named for an organ does not equate with an organ disease. So a typical Western disease diagnosis would be understood in Chinese medicine as 3 to 5 different syndrome patterns. For example, chronic fatigue syndrome can be differentiated as several unique patterns in Chinese medicine. One patient may exhibit the syndrome pattern of kidney yang deficiency with pale complexion, frequent urination, and back pain. Another patient may exhibit spleen yang deficiency with loose stool, no appetite or desire, and sore muscles. And yet another chronic fatigue patient could be heart yin deficient with insomnia, irritable mood, and late afternoon fever. These 3 different syndrome patterns would receive different treatments. Also, a Chinese medicine syndrome pattern will change over the course of the disease progress and with seasonal changes. In contrast to Western medicine, which focuses on eliminating the pathogens, such as virus, the intention of Chinese medicine is to restore the yin-yang balance in the organ systems. The most important goal in Chinese treatment is to preserve the healthy qi, called zheng qi in Chinese, and remove the pathogenic qi, such as cold, heat, damp, dry, and wind. Unlike Western medicine, naming the disease is not helpful in determining the treatment. Traditional Chinese medicine therapies target the syndrome and consider the stage of the disorder. They are not directed to the symptoms nor to a chief complaint. Acupuncture and herbs are the most common therapies. Other treatment options include moxibustion, acupressure, massage, diet therapy, psychosocial counseling, visualization, and physical exercise.
Acupuncture works mainly on the meridians, which are the energy networks connecting the inner organs with the external body surface. Therefore, inserting a fine needle on the outer skin can affect the inner organs and adjust the unbalanced qi. Herbal formulas are used every day by Chinese medicine doctors. Herbs have very complicated components and functions, but in general, they can be classified into 2 categories: tonic herbs and sedate herbs. Tonic herbs tonify, which means strengthen and nourish. They are used for deficiency syndromes. These are all tonic herbs. This one is called Gui Yuan, which is used for kidney yin. This is Sheng Di, which is used for kidney qi and is help to increase the body liquid. This is Gou Qi Zi. They are used for tonify liver and is also good for kidney. This is Du Zhong. It's a bark of a tree and is used for tonify the kidney qi, which can help back pain. This is Bai He Hua. They help to calm down and help to go to sleep in the evening. It goes to the heart. This is Mei Gui Hua. They are rose buds and they are used to help the menstruation flow and help to move the blood. It's very good for women. Sedate herbs have reducing and dampening functions. They are used for excess syndromes. These are all sedate herbs. This is shanjiapian, which we use to reduce the food from the body's help digestion. This is sanbaipi, which is also a bark of the mulberry tree. It helps to get rid of the phlegm from the lung system. And this is huangqin. It's very bitter taste, and it's helped to clear the fire or heat from the body. This is seeds of the peach, and it's helped to move the stool. And this is a honghua, which is red flowers from Tibet, actually, and they help to move the blood stagnation. This is a fuling. They remove the dampness from the body. This is a chrysanthemum. This is a juhua in Chinese. It's clear the heat from the upper body, so it's very good for the eyes and the headache. So herbs are always used in combination by Chinese medicine doctors. They usually consist of 6 or 15 herbs in a formula. Each formula was specially carefully designed for individual patient.
Traditional Chinese exercises, such as Tai Chi Chuan and Qigong, can help relax both body and mind, strengthen health, and prevent illness. Both Qigong and Tai Chi Chuan require the state of relaxation, stillness, and deep breathing. The movement is smooth and effortless, like flowing water and a floating cloud. As described by the classic literature, movement occurs in the center of stillness, and stillness in the center of movement.
Like acupuncture and massage, Tai Chi Chuan vitalizes the flow of qi in the meridians and therefore has therapeutic effects for chronic diseases. For example, when people practice Tai Chi Chuan, they may feel a tingling sensation or warm feeling in those areas where they have been having problems. After a while, the symptoms will be alleviated. Heart disease, diabetes, arthritis, back pain, high blood pressure, anxiety, sleep disorders, and fatigue can all be improved by Tai Chi Chuan. Tai Chi Chuan and Qigong are important exercises for traditional Chinese medicine doctors to practice daily. When acupuncture practitioners obtain the ability to move qi freely to their hands, their acupuncture has maximum impact and sometimes have miracle effects. Chinese hospitals use Tai Chi Chuan and Qigong for rehabilitation. Patients practice Tai Chi Chuan with their doctors and also receive Qigong treatment. They feel the qi sensation of comfort and warmth coming from the doctor's hands and needles. As a result, the patient will improve quickly. So many factors can influence the course of a disease, such as one's constitutional type, living conditions, and the unique situation of one's job, family, diet, and concerns. Chinese medicine doctors understand that biological distress is closely connected with the social and emotional stress. Therefore, we always try to understand the individual patient in a very broad way instead of only focusing on the disease per se.